All right. So CMV in pregnancy is likely to be a very important topic as far as exams are concerned, whether it is part two or part three, because there have been recent updates, like there have been the SIP, which has recently come, plus in July 2025, there is a recent TOG article. The last TOG article was somewhere in 2016. So there have been updates, and we know that this is the most common viral infection that can cause congenital problems in the baby. And that is why it is one of the important questions in the exam, and it may figure in the MRCOG Part 3 exam as a station. It has not come as a station, but it is a potential question that can be asked. All right. So what we would do is we would just have a station discussion and a little bit about what are the updates in the TOG article regarding CMV, which may again come in the exam in various forms, clinical scenarios. So you would need to know. All right. So can we start with the task? It would be a short class, maybe half an hour. So we will do this one session, and after that we'll just discuss about CMV, the new TOG article. Anybody would like to do? Dr. Anju, how about you?
I have not read.
Okay, you can just attempt. There would be cases that you
Oh,
have not read, so
yeah.
you can try, you can attempt. All right?
Okay.
All right. I'll just display your station. Give me a moment. Yeah.
Next sheet, please. Okay. I could start.
Okay, you want to start? Start. Okay, start.
Uh, Hello. I am Dr. Anju, registrar at clinic today. May I know your name and age, please?
Hi, I'm Amelia. I'm 30.
Okay. Hi, Amelia. I have gone through your GP letter and I understand you were here to see my consultant, but I'm sorry my consultant is not around and I can take the consultation and fix the appointment with him later.
All right, that would be fine.
Okay, so I've gone through the GP letter and I'm aware of your situation. Can you tell me in your own words what brings you here?
Well, yes, doctor. Actually, I'm a bit worried because I know about this CMV infection and that it can harm my baby if I get it in the pregnancy. Now, I teach in a school, and there was a student who has recently had CMV infection. So I was worried, and I visited my GP, who asked me to do certain tests, and he said that you would be discussing the report.
Yeah. So, was the report discussed with you?
No, he hasn't.
Okay, so I'll be discussing your report and we'll address all your concern. Before that, I need to ask you a few questions. Okay,
Okay, all right.
so can you tell me, do you have any fever or cold cough at present?
No, I don't have anything at the moment.
Okay, and any time in past, had you ever had CMV infection or tested for
I
same?
don't think so. No, never.
Okay, and how have been the pregnancy so far?
My pregnancy otherwise is fine. I have done my investigations and everything. So it's been fine.
Okay, all booking tests done.
Yeah.
So, is this your first pregnancy?
Yeah. No, this is my second pregnancy.
Okay, so can you tell me more previous one?
I have a 2-year-old kid, and it was a straightforward pregnancy. I didn't have a problem.
And your delivery was?
Vaginal delivery.
Okay, and any other medical illness?
I don't have anything.
Any surgeries?
No,
Any drug allergy?
no.
Are you aware of your blood group?
A positive.
Okay, and your weight to height ratio?
That is 24.
And any reservation against blood?
No.
Okay, any family history I should be aware of?
Nothing.
Are you well supported at home?
Yeah, I am.
Please don't mind me asking, do you smoke?
No.
Take alcohol?
No, I don't.
Or do drugs?
No, never.
Okay. And of late, have you felt low or depressed?
No, I'm fine.
Okay. Thank you for the answer. I have confirmed your report with your name and NHS number. I have quite a lot of information to share. Do you have somebody by your side?
No, it's okay. You can tell me. What is it, doctor?
So actually, the CMV infection we tested you for, the antibody against it has come positive. That is, we call it as IgM and IgG. IgM antibody reflects a recent infection, and IgG tells that there is a past infection as well. But in case
Mhm.
of CMV, to a certain with certainty that this is a recent infection, we need to do a further test, which is
Okay.
called IG. Yeah, blood test. A sample will be sent for IgG avidity test. That would
Uh-huh.
further give us information that if this test, which your test has come positive, you have got this infection at present from this baby who was infected from the child, or it is a old infection. Am I clear?
Okay, got it.
Your management will be by a multidisciplinary team, which would include my consultant, the infection specialist doctor, the radiologist, the fetal medicine doctor, and
Mhm.
once we get that test done, if it comes out to be a infection which had happened earlier and not a new one, then nothing to worry about. Your body can fight the exposure you had. But however, if it comes out that it is a recent infection that we need to further investigate. Am I clear?
Okay, so how do we know that it is a I mean, how do we investigate further?
So I will order a test which is known as IgG avidity test, and if
Mhm.
it is comes out as a low avidity, it suggests that it is a recent infection within 3 months. So if that is the case, we will refer you to fetal medicine expert doctor.
Mhm.
First of all, I would like tell you that CMV infection usually affects when it is a later period of pregnancy and first trimester. Since you are 13 weeks, the chances of baby being affected are low. But if you want to test, then I will attach you to fetal medicine expert doctor where they can offer a needle test and
Mm-hmm.
check if the baby is affected or not. Am I clear?
Okay.
So, why are we worried? Because this infection can cause problem with the baby's hearing
Mm-hmm.
when the baby is born. Also,
Mm-hmm.
babies who are affected with infection, uh, they have a certain degree of mental impairment when they are born. The intellectual capability is less. I'm sorry to be saying that. So we would have to check the baby if the baby is infected or not. Am I
Oh my
clear?
God, doctor, but what is the chance of that happening?
Usually it is less in at this period of gestation, but it would be confirmed only after we do the needle test.
Mm-hmm. And when would you be doing the needle test?
It can be done around after 20 weeks of period of gestation, that is after 6 to 7 weeks.
Mm-hmm.
We'll be doing that test, and if that comes out to be positive, some women might choose to terminate pregnancy, and we will start you on antiviral therapy also, a drug we call as valacyclovir that helps the virus. If it is found to be a recent infection, we'll start with your drug, the drug for you.
Doctor, but
Okay.
you mentioned about termination. I'm not quite comfortable with that. So when will we come to know about this?
So when we do your testing, and after the test, we get to know within 2 to 3 weeks the report will come.
Mm-hmm. Okay.
And if the baby is not infected, then everything goes well. However, if affected, then it would be your choice how to go
Mm-hmm.
about it. I know I am giving you a lot of information. I will give you patient information leaflet, and I will also attach you to my consultant, and I will document our conversation. And I know this is a difficult time for you. I can attach you to the counselors and support groups also.
Okay, but doctor, you said you will be starting some treatment. So will that not help me? I mean, to
It has
prevent the
shown
baby's infection?
Yes, it has shown to help the infection. However, it is not 100%. It has shown to decrease the viral load, and thereby the babies will be helped with the tablet.
Mm-hmm. Okay.
Do you have any more concerns?
Oh no, but this is so upsetting, doctor. I'm not quite sure what is to be done.
Yeah, I'll be attaching you to my consultant for further visit. And
Yeah. Your time is up.
yeah,
Yes, Dr. Anju. So, what do you think? How did you do?
I had very vague idea of the station, but
Mhm.
mm,
Okay. All right. I would say you did a good job. Okay. In the sense, you were on track. You knew what was going on. And you mentioned so many other applied clinical knowledge points like valacyclovir and all those things that you would need to consider for CMV infection, which is good because see, you were saying that this was a new. I mean, you have not read about CMV, but yet you did. So this is how you need to approach your tasks because not all CMV or not all stations would you be familiar with in the exam. So it is important
yeah,
to keep calm and to know that at least history I'll be able to take on based on history. There are certain things that I would be able to tell her. that this is what we need to do. And wherever there is confusion or you're not quite sure, you always need to say that I would involve the consultant in this. Because rather than saying something that's wrong, it is always better to say I will seek opinion. Okay. So
Yes.
that's very so if you do that way, then you would gain on safety because you're making a safe plan. You're not just saying anything because you don't want the patient to feel that you do not know. So you are involving the consultant. So you are not compromising on safety. You may lose on applied clinical knowledge if you don't know anything about the topic, but if you say such things, no, whenever you are unsure that I will involve consultant or at least do your basics well. Okay, identify risk factors. Okay, the general advice that you would give. So there should be no station that you should say that, okay, I know nothing about this. You would know because a patient who comes to your clinic will never come telling you that, okay, I'm coming, this particular patient is coming of this particular condition. You need to deal with the patient. So, similarly, you need to deal with your tasks. And what you did was a very good job. All right. So, coming to CMV infection. So, yes, you were right on most of the aspects of management. Let's go through the key. So, firstly, when she said that I've had an exposure. So, always start by the chief complaint that she's come with. So, she said that she knows that a particular student had CMV confirmed infection. So, you start by asking the history of exposure, so the time, the place, when was it, how long back, and the duration. Okay, so how close was she? Okay, so that is important. Whether it was there at all, or she may just be concerned otherwise. Okay, that's important. Then currently, as you said, any fever for her, any malaise, any. Do you feel weak or do you feel sick? Are you having fever? Okay. Have you noticed any swelling around the neck, lymph node swelling? So such questions can be asked to know if she's already having CMV. As you asked, any personal history of CMV in the past, so you asked that as well. Any previous pregnancy, you asked, good. Medical diseases, surgeries, allergies, addictions, BMI, blood group, mental health and support is all that is important. Okay, so be ask whatever is relevant. Okay, do not ask in this case smears. Do not ask even reservation to blood transfusion because you're not going to do that for her. Okay, blood group is important because if you consider a needle test or a referral to needle test basically, you need to know the blood group. All right, that is why BMI is important because again it would make the needle test difficult, etc. So ask what is relevant to your particular task. All right. So this is about your information gathering, communication. Your empathy was good. You gave information in chunks. You did avoid medical jargon, and you were checking her understanding. You were asking, "Am I clear? Am I clear?" And non-paternalistic is basically you're not imposing your opinions on her. You asked her for options. I mean, you asked her for what her opinion was. You mentioned about termination of pregnancy, but you said some women choose termination. So that's good. Okay. Now, as far as the report is concerned, now she has IgM as well as IgG positive. Okay. Now, if she has IG, how to explain in the first place? So, what you need to tell her is that after every infection, what can happen is the body develops certain proteins called antibodies which fight the infection. So in the recent, if it is a recent infection, there is IgM antibody, as you rightly said. If it is an old infection, then the antibody that is there would be IgG. You seem to be having both the infection, both the antibodies, that is IgM as well as IgG. In such a case, with this particular infection, that is CMV, we cannot rule out whether it is recent or earlier infection. Okay, so in that case, so first is if you know that it is IgG, okay, and if she has IgG, okay, and she doesn't have IgM, what would you think it is?
Cold infection.
Okay, it is old infection. Is she at risk?
No.
She
If it
is
isn't.
less likely to be at risk. But remember, even the old talk article and new talk article says that 50% of CMV infections in the baby, in the newborn, are because of secondary infections or reinfections. Okay, so she may get reinfected despite there being IgG, but it is not very common. Reinfection is not so common. Okay, but in congenital CMV, 50% of congenital CMV, if you take all the congenital CMVs, 50% of congenital CMVs result from a reinfection or reactivation. Okay, so that is why you can reassure her saying that yes, you do have immunity, but there is a small risk that the infection may come back or recur. Okay, so there is a small risk, so we need to look out for it. Okay, that is if IgG is positive. Okay, well, I'll just show you that chart. 1 minute. Sure. Okay. Yeah. So this one I was saying that if IgG is positive, reinfection is unlikely, but it is possible. So you just say that reinfection is unlikely, less likely, but it is possible. Okay. Now, if it is IgM negative and IgG negative, this, okay, if both are negative, then it means currently she's not having infection. Okay. However, if she gets the infection, she may seroconvert. That means if she's negative now, she may become positive later if she gets the infection now, right? So in that case, you need to repeat after 3 to 4 weeks because she's had the exposure now. She's negative for both. That means she's susceptible. She doesn't have immunity. She's susceptible. And if she gets the infection from that child, she will eventually develop the antibody. So if that negative becomes positive, that means it is a recent infection. All right. Now, if it is positive and positive, so IgM is positive, IgG is also positive, then what do we do? Okay, so both are positive. So again, as you said, it depends on IgG avidity and whether she's had infection earlier or not, because IgM normally is indicative of recent infection, normally for all the other infections. But what happens with CMV? IgM can last longer. Okay, so if it can last as long as 1 year, so she may have got CMV before the pregnancy, and now the IgM is just there for a year. That is a possibility. That is why when you have IgM with CMV, you cannot say for sure that it is recent infection. That is why we do avidity, IgG avidity, as you said. Okay, so and another thing that we do is we also check the booking bloods that she had given earlier for serology. Why? Because if the booking blood was negative and now this is positive, that means there is somewhere now that she's encountered CMV. Okay, so in addition, what you had to say is that booking blood is to be checked for serology. Okay, the blood that she has given during booking, that is reserved always for such things. So you need to check that blood, whether the serum of that blood, whether she had any antibody or not. If she didn't have antibody and now both are positive, that means this is now that she's got infected. Okay, so that's one thing. And if that is the case, then you don't even have to do avidity. But if that is not the case, if there were antibodies then, there are antibodies now, you will have to do IgG avidity. Okay, as you said. So this is the next step. IgG avidity. First step is serology of the booking blood. If the serology of the booking blood is negative, you know it is seroconversion. You stop at that. But if it is positive, that means even then it was there. You need to confirm whether it is recent or old. So you have to do avidity. If the avidity is low, less than 30%, it is recent infection. Okay. If the avidity is more than 60%, then it is old infection. Okay. And this is booking sample blood. IgM and IgG are negative, and now they are positive. That means it is a new infection. Is this clear? Everyone?
Yes.
Anybody has any questions? Okay. Yeah, any questions? Anybody?
No, clear.
Okay. So similarly, if IgM is positive and IgG is negative, okay, again, it may be what is said is this is something that is very unlikely. IgM, yes, it can happen in very recent infection because the first antibody that rises is IgM, isn't it? And then your IgG starts coming, right? So if you find IgM and don't find IgG, that means it may be a very just the exposure may have caused that. Okay, but it is also possible that it may be falsely high because CMV reacts with Epstein-Barr virus. It can be the Epstein-Barr virus which has caused the IgM to rise, which appears like CMV IgM. So it's cross reactivity. Okay, so in that case, again, you repeat serology. Okay, so by 3 to 4 weeks. So by 3 to 4 weeks, your IgG, if it was a new infection, your IgG by 3 to 4 weeks would surely come. Okay, so IgM comes early and then after a while IgG comes, right? So if you repeat after 3 to 4 weeks, your IgG would come. But if the IgG has still not come, that means the IgM is false positive. It is possibly cross reactivity because of other viruses like EBV. All right, is this clear, everyone?
Yes.
Okay. So if
Ma'am,
you think,
ma'am,
yeah, yeah, yeah,
ma'am,
tell me.
if after repeating after 4 weeks, if it again comes like IgM positive and IgG positive, I mean, like
That
it
is
was
infection.
just yeah, just like that time she got the infection. The
Yeah.
if ma'am, the last one I'm telling, if just now this and then after 4 weeks, if it is both positive,
Yeah.
then should we proceed? When then we should get again
That means
avidity
you got
or
the answer, no? That means it is recent infection, no?
recent infection. Then we'll be going in the line of the just pre post conception. I
Yeah,
mean the
yeah,
fast case. Yeah.
correct, correct.
Okay.
Yes, yes,
Okay.
absolutely. Okay.
Okay.
So if the other thing is now, if you think that there is new infection, you start the mother on valociclovir, 8 gram per day. Okay, 8 gram per day
Okay.
is very high. You need to monitor renal function here. And otherwise, headache and nausea are the common side effects of valociclovir. You may not have time to say all these things, but in case it comes as a structured discussion, they ask specifically, then you may need to know. But renal function has to be monitored. And valociclovir is given as a secondary prevention. And you continue and you do amniocentesis at 21 weeks because it may not be positive if you do it very early. Okay, so you do it at 21 weeks. Now, this is for, remember, they have divided into less than 24 weeks and more than 24 weeks. This is, we are discussing less than 24 weeks. So, if the CMV encounter or the exposure is less than 24 weeks, this is the chart that we follow. In for diagnosis of CMV, it is the same whether it is less than 24 or more than 24 in the mother, but it differs slightly for what you do for the baby. That is why they have divided into less than 24 and more than 24. So if it is less than 24, your valacyclovir is going to be started and you do amniocentesis at 21 to 22 weeks. And then if the amniocentesis is positive, okay, if the amniocentesis is positive, you will continue the valacyclovir and then we'll see the next chart. And if the amniocentesis is negative, and of course you'll have to do a fetal medicine center, ultrasound, etc., which is the figure 4 that is mentioned here in the talk article. We will be seeing that. So basically what they're saying is if it is positive amniocentesis, it is very reliable and you need to check serial scans to know if the baby is developing abnormalities. Okay, so that is the figure 4 that we would be seeing. And if it is negative, then you stop the mother's valacyclovir because it is when it is negative, it is less likely that the baby would be having CMV. But in 3% of the cases, even with a negative amniocentesis, congenital CMV may occur. That is why you offer neonatal CMV PCR within 3 weeks from birth. Okay, so you stop all of the drugs if it is negative because it is less likely, but it cannot be ruled out. And but you do a neonatal CMV PCR within 3 weeks from birth. All right, is this clear? So why there is a difference between 24 weeks and less than 24 weeks and more than 24 weeks as per the new guideline is because this drug, valacyclovir, is not very effective more than 24 weeks. So usually what is done is an amniocentesis is not done typically, usually to know whether there is infection. First, what you do is you do in more than 24 weeks is what I'm telling you. You do ultrasound, and if the ultrasound is showing any such features, then you to confirm you do amniocentesis. But first, you don't do amniocentesis because knowing that the baby is positive and nothing can be done because valacyclovir is not very effective more than 24 weeks. That is the difference. All right, so that is why we have less than 24 weeks and more than 24. So this patient was 13 weeks, so this chart applies. Now, okay, so if you have confirmed amniocentesis, this is the next thing that you would do. If it is confirmed with amniocentesis, you would do detailed fetal ultrasound every 2 to 4 weeks. You will do a pre-fetal brain MRI every, not every, 28 to 32 weeks, somewhere in between, with or without. So if you have suspicion on the ultrasound, you can do MRI. Okay. And then the baby becomes asymptomatic. If there is nothing on ultrasound, nothing on MRI, mild, moderate, symptomatic, like a few signs here and there. And if there is a severe problem like severe ventriculomegaly, etc., then she becomes a severe case of CMV. All right. Now, if it is when you're doing the ultrasound, see, ultrasound is done. Another thing that you must remember is ultrasound is done after your amniocentesis, and after that, maybe every 2 to 4 weeks you will do. So by then, the time for termination may be over unless it is severely symptomatic. Then you can terminate under the clause E. But otherwise, you can 24 weeks would already be done. So what you can advise the ladies, the women, is that they can even now with simple amniocentesis, they may consider termination because the simple reason is that for the ultrasound abnormalities to become apparent, it may take 12 weeks after the initial infection. Okay, so that is why you can offer them if they are positive with CMV amniocentesis, you can consider termination of pregnancy as well. Okay, that is if they are willing for that. Okay, so but otherwise you offer termination if there is the baby is severely symptomatic. Okay, yeah. So this is what you need to know. And after delivery here, what is done is basically you do a test for the baby. That is CMV again is done. Test for the baby PCR. You do all other parameters of the baby are tested, like complete blood count, liver function test, renal function test, because all those parameters are affected in CMV. You can have thrombocytopenia, you can have your liver function derangement, etc. So all of that is done. Ophthalmologic examination, audiological examination, because SNHL can happen, and placental examination after delivery. And if the baby is affected, you start for the baby valganciclovir, 6 milligram per kg twice a day. And the duration depends on how severe the condition is. So if it is very severe, then you give for 6 months. If it is less severe and it is like just the counts are deranged, you give for 6 weeks. So valganciclovir is given for the baby. So these are certain changes that are there in the recent guideline. Okay, so that's the thing. Now let's just quickly, these are the various ultrasound abnormalities. You have clinical abnormalities. So what will you explain to the mother? As you said, you rightly said there are various issues that can happen. You need not just directly talk about mental handicap. First, tell about the lesser problems, and then say that don't, we are not quite sure, but there is a risk of mental handicap, etc. if the baby's brain is affected. Okay, so first tell sometimes what can happen is baby can have jaundice, baby can have rash, liver issues, then low hemoglobin, low counts basically, and growth problem for the baby, smaller head for the baby. Okay, and sometimes baby can have serious problems with brain function and brain formation, and that is why uh, this is taken seriously. Okay, so all of these things you have to explain to the mother, and even if the baby is fine, long-term problems may persist, like the developmental problems, and hearing problems may be there. Okay. Now, only 15% of all congenital CMVs are symptomatic. So, if she asks you, these percentages are important. 15% are symptomatic. Okay. Of those who are not symptomatic, of those who are asymptomatic, around 15 to, you can remember the percentage, 17% is what is mentioned. It would be having SNHL. So of those who are asymptomatic, okay, around 15 to 20 would have SNHL. Now, the other thing is about about the trimester-wise transmission. You mentioned about yes, the transmission may be lesser in the first trimester, but the affection is not less, Dr. Anju. Okay, so if she acquires CMV in the first trimester, the possibility that the baby would be infected is less. But if the baby is infected, then the problems may be more. Okay, so that is the thing about first trimester. Just like any other infection, if say varicella affects in the first trimester, all these problems, microcephaly, etc., will happen in the first trimester because that is when the growth of the brain is happening. Once the baby is fully grown, then suddenly the brain will not shrink. Okay, so although the infection transmitted to the baby is more in the third trimester, and that is because the placenta is big. The transmission is by placenta. The affection of the baby is more in the first trimester. Okay. So, yeah, so these are the various points. What are the fetal and neonatal effects we just saw in the table? I think one of the slides we missed. Yeah, this one. So, explaining a report, IgG avidity and booking serum serology has to be done in this case, as we discussed. So, if the booking is negative, now is positive, that means she's recently got the infection. If the infection is there, you start treatment for her and continue till amniocentesis is done. And amniocentesis, once done, if it is negative, you stop valacyclovir. So basically, these words are buzzwords which are important. FMU, that is fetal medicine unit referral, which you said. Good. Okay. If amniocentesis is negative, you discontinue. This is what I was asking you. How much would it help? Your valacyclovir that you start, how would it help? So it will reduce the risk of transmission by 70%. This is important because the percentage is big. So they may ask you how much would it really help? So yes, it would help by 70%, which is a big percentage. So, if it is positive on amniocentesis, you do ultrasound monitoring and may offer termination of pregnancy because the ultrasound findings or the ultrasound abnormalities may be apparent after 12 weeks. So, that is why you can offer termination of pregnancy earlier. Okay, so this is what we already saw. Okay, fetal neonatal effects we saw. So at the time of delivery, you say that the baby would be tested, blood samples would be taken of the baby, and the placenta also would be tested. Baby's blood tests like liver function and the blood counts would be done because that can be affected. So that would be checked, and the baby would be monitored accordingly. If if the baby is found to have the infection, then we would start on a antiviral, which is called as valganciclovir. Another point which is important here is that if she's planning another pregnancy in the future and currently she's having an affected baby, then she should avoid a future pregnancy for a year, because the current affected baby, can continue shedding the virus. So she can again have a reinfection in the pregnancy, less likely, but can have a reinfection in the next pregnancy. And that pregnancy as well can be affected. So it is recommended that she has a gap of minimum 1 year before she tries to conceive the second time. Okay, the next time. All right. Is that clear?
Yes.
All right. So, and if more than 24 weeks, the value of the points, this is just in case you get a station where there is the gestation is more, the value of amniocentesis or a valacyclovir treatment beyond 24 weeks is less clear. That is why it is amniocentesis is not done first. A referral is done to a fetal medicine center and an ultrasound is done. If there are no ultrasound signs of fetal CMV, it is reasonable and preferable not to offer amniocentesis, because what happens is as the pregnancy advances in the third trimester, the risk of amniocentesis increases, in the sense preterm labor can happen in 1.2% of the cases. All right, so that is why you don't do amniocentesis then. But if the ultrasound is abnormal, then you must confirm, right? So you then do amniocentesis if the ultrasound is abnormal. So it is the same pathway, but it goes, the ultrasound comes first and then would be your amnio. Okay, so yeah, so basically here, all this is the top part is same. Okay, the diagnosis, all this is same. Okay, so sorry, all this is same. Now, here, if high avidity means preconception, nothing to be done. Here, if IgM, IgG positive, low avidity, or Ig, if you find that the serology at booking was negative and now it is positive, or if you find that IgM has come up now when it was earlier negative, then again you have to refer to a fetal. That means basically when you test positive for CMV, here the difference is first refer for ultrasound, there amniocentesis. Okay, so here first ultrasound, there amniocentesis. If the ultrasound is abnormal, then you will do an amniocentesis. Okay, so that figure 3 is for that. And if it is normal, you will continue follow up and baby would be tested. Okay, so that is how these two things would differ. Okay, so this is what, if the ultrasound is abnormal, and maternal serology is basically saying that CMV is the cause, and then you offer amniocentesis. If the maternal, so if you first find abnormal ultrasound suggestive of CMV, but maternal CMV both are negative, then it is less likely to, I mean, it is not likely, not possible that it is a CMV that has caused the ultrasound. Then you have to look for other causes of abnormal ultrasound, is what they are saying here in this chart. Okay, so if you like, this is if you first find the abnormal ultrasound. Okay, so if you find an abnormal ultrasound, you do a maternal serology because of suspicion of CMV infection in the baby. Maternal serology both are negative, then it excludes CMV. But if it is suggestive of all those factors, like the ones earlier we saw, IgG positive, for example, then it would be high risk for congenital CMV and offer amniocentesis. Okay, so less than 24 weeks, remember, the first thing that you would like to do is confirm whether it is actually CMV by doing all the serology. And if it is positive, if it is a serology suggests infection, less than 24 weeks, first thing is amniocentesis. Amniocentesis is positive, then serial ultrasound. More than 24 weeks, if serology is suggestive of a primary infection with CMV, then you do referral to a fetal medicine center first for an ultrasound. If the ultrasound is showing those specific features suggestive of a congenital CMV infection, then you do amniocentesis. So the order changes basically. Okay, less than 24 weeks and more than 24 weeks. All right. And another small point which is mentioned in the current guideline is a current article is breastfeeding. Breastfeeding in if the baby is affected is safe and recommended during the first 6 months. But if the baby is low birth weight and baby is preterm, and there is a possibility that you could transmit CMV to the baby, breastfeeding may transmit CMV to the baby. So that is why it is recommended that you pasteurize breast milk. Okay, pasture for infants may be considered at risk, may be considered. So if the babies are the babies are at risk, that means the baby is negative, but the mother is having CMV, there is a possibility that there may be transmission of CMV through breast milk, and that is why, particularly for preterm, because they are at greater risk, you would need to consider pasteurization of breast milk. This is not always possible, but can be considered. All right, is that clear, everyone? That was the entire gist of the new guideline of the new TOG article.
Um,
All right, yeah,
if it is more than 24 weeks, just the last slide. When
Mhm.
we get up to 24 weeks, we will first sending her, if we are suspecting CMV, then first we'll be sending her to the fetal medicine specialist. Then we'll be
Yeah.
starting ultrasound. Now, if in the ultrasound we get something abnormal specific for the baby, then it is written like we are checking the serology. Is it the second repeat serology of the mother,
No,
or
no, 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 no.
it
That
is
is what.
the
No, no, no. That is what I was saying. That if this ultrasound is the first thing that you find, you've not done
finding?
serology.
So
If you just find you are doing a 20-week scan, right, for a fetal anomaly scan. In that scan,
yes,
if you find that there are some stigmata of CMV, then you do serology, right? So that is what they are saying.
yes.
So this is a separate chart. But the other things is what they're trying to say is after abnormal
And more than
ultrasound following
24
a
weeks, more
serology.
than 24.
Yeah, more than 24 weeks. So after an
Yes.
abnormal ultrasound, following a serology which you have already done for whatever reason,
Okay,
like
okay,
exposure,
okay,
then
okay,
you would
okay.
do a amniocentesis. Another reason why you would have done
That means this
serology,
serology is the first one, not that after ultrasound
yeah,
we are again repeating. It's not like that.
no, 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 the first one, index sample.
Okay.
Okay,
Index sample.
but
Yeah.
if it is
Okay.
the first instance that you have seen is the ultrasound is abnormal, then you do the serology. In the
Okay.
sense, if
Okay.
you have seen her for the first time with the ultrasound, you have not done her serology, then you will do her
Okay.
serology to know if it is CMV or
Yes,
not.
ma'am. Yes, ma'am.
Okay,
Yes, ma'am. Yes, ma'am.
that way.
Okay. Okay.
All right. Okay, any
Yes,
other
ma'am.
questions on this?
Ma'am,
Okay.
one more doubt, ma'am.
Yeah. Yeah,
After
tell me.
24 weeks, we are doing amniocentesis after abnormal USG, ma'am. But what is the
Yeah.
point in doing amniocentesis at 32 weeks, ma'am?
That is to
Uh,
confirm. That
serology
is
is
to
positive.
confirm that it is CMV.
But anyway, we are not going to terminate the pregnancy, ma'am. But why should we confirm at 32 weeks?
Oh, yeah, but that is to for the mother's benefit. I mean, to for the prognostication, like how you do with sometimes with Down syndrome, etc. You even if you find something in the third trimester, you would still do amniocentesis for the purpose of prognostication for the mother, for the parents. Okay,
Okay.
so that is
Okay.
the reason. Otherwise, nothing as such.
Okay, ma'am. Thank you,
Okay,
ma'am.
yeah. All right. So, good night, guys.